The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Welcome to Mature Lifestyle. I am Libby Mitchell, and I'm so excited to be back working with my friends at Spectrum Generations because the programs they bring to you bring you information about making our lives even better as seniors, and I'm very excited to be back. I'm also excited to be sharing with you the reading room at Lithgow Library in Augusta. So it's beautiful. If you haven't been here, come. But today we're going to talk about other things. Choices for the end of life, and choices is the most important word. Got two great guests today. Both of them is obviously important to them because they have dedicated their professional lives. First, I have Pam Brown over here, who, as young as she is, has been doing this for 22 years. She's been working with patients and their families, talking about the choices they want to make at the end of their life. And you're a nurse, and you chose this. And then we have another young woman who's been at this for almost 30 years, Candace Powell, who is a nurse also, but she also has continued on to develop hospice-level issues at the state level, but works closely with Pam. So Pam, talk to me. Why do we, as seniors or as young people, want to talk about end-of-life care? We'd rather not talk about that, you know.
Right. It is a topic I find, Libby, that a lot of people try to avoid, but it's so important to know what your choices are. As you know, before you're approached with the situation, you know, to be able to talk about what's important to you, what's important to your family, what's important as far as symptom management, aggressive care or not aggressive care, and the more information you have, and to write it down, I think is vitally important.
It is important to write it, isn't it? Because
it is. You know, many people have heard of living wills, and now the post, and you know, Candace is very versed on the post form, but it's actually what your wishes are written down on paper, what's important to you. It was interesting because my husband and I actually sat down and wrote out. Yeah, we did this. Actually, it was about 7 years ago.
So you don't wait until you're sick.
No.
You better think about it before that, right?
Yeah, and I was amazed because I have been doing hospice for over 20 years at that point, or even greater. And I was just amazed on how what I thought he wanted and what he wanted was very different.
And so you had a very honest conversation about a very difficult topic, and you're an expert in it. It was still hard.
It was still hard. It was still hard. Yeah.
So let's back up a minute. What is hospice in the first place, and what do we mean by having a choice with hospice? And I think the other word that you two use very well is palliative care. What is palliative care first, and then I want to come back and talk about what is hospice.
Palliative care, very simply, is comfort care.
Comfort care.
It's providing the very highest quality of care, symptom management for folks at the end of their lives, and respecting their dignity. It's just a very, very simple, very basic, a very complex word even to say sometimes.
It is.
Yes, it is.
But doesn't that just happen automatically?
Not necessarily.
All right, talk about that.
Sure. We'd like to think it did.
Yeah.
But no, you know, we're people first, and we bring who we are into our professional lives, and sometimes anxiety and fear that healthcare professionals have preclude us from maybe doing some of the things that we know would benefit patients. It's not deliberate, it's just who we are and we're people first. We also have a system to work with, and the system sometimes gets in the way.
Well, I want to go back a minute. You work hands-on with patients and with also nurses, teaching them how to deal, right?
Yes,
with patients. Could you talk to me about what you do for a living every day?
Yeah, sure. The majority of my job is hospice education.
Hospice education, which is one of the things we're trying to do today.
Absolutely.
Even professionals struggle with totally understanding, I assume.
Yeah, absolutely. And part of my job is to educate not only our staff, but also the community. And that incorporates the nursing facilities that we have a contract with that provide our respite care and some of our GIP, general inpatient admissions, that we can talk a little bit about that in a little while. But the nursing home education, also community, a lot of community education. I go out and just educate people on what end-of-life care is and what their options are. And as a matter of fact, I just returned from a health center this morning. I had gone to a health center and talked to one of their meetings about hospice care and how they can access it, how their patients can access it, or how to kind of smooth that transition.
Well, you're talking to the community now. So how do people access hospice care? Is it available to anybody who is in that stage of life, or as a choice?
It is. There's a couple different programs. Under the Certified Hospice Program, there's Medicare Certified Hospice and there's Maine Care Certified Hospice. Medicare is for patients who are 65 years of age and older or disabled for 18 months or greater. Maine Care is income contingent. But the other plan is many private insurances now have hospice benefits, and they all sort of mimic one another. Would you agree with that? I mean, as far as the per diem rate, they might be a little, the Medicare and the Maine Care mimic each other, but the private insurances follow suit pretty much.
So by and large, if you have insurance, whether it's Medicare, Maine Care, or your private insurance, there's usually a provision for this choice. Well, then, if you qualify.
Yes, if you qualify, there is a criteria to qualify.
What are some of those criteria?
One is a 6-month or less prognosis. Now, when we're talking with families, I try to avoid that language. I try to avoid more life-altering or life-threatening, illnesses. That's one of the criteria. The patients and families need to want comfort care. Is that their choice? Is that what they want? What are some of them? I'm trying to think if I'm missing something. Those two, and to have Maine Care, Medicare, or private insurance. The other thing I do want to mention, though, too, that there are many agencies, for example, ours at Health Reach, we don't deny care according to what someone can afford.
And if it's the appropriate care,
absolutely,
you will work to find a way to make it happen.
We will. And I know other agencies do that as well. So
I think another point too, Pam, is that hospice supplements family care and the members. It doesn't take the place of family.
Absolutely.
It just supplements that family care.
Okay, I'm going to ask you a question, and that goes right to it. Is hospice a place, or is hospice your home? What is hospice?
Hospice is actually a philosophy of care.
Philosophy. It's not a building that you go to.
There are inpatient hospice facilities. We have 2 lovely ones in the state, one in Auburn.
So it could be.
It could be. There are many different structures of hospice where hospice is delivered.
Yeah. So share that with us a little bit.
Sure. In the United States and in Maine, certainly, hospice primarily is provided in the home.
In the home.
And as I say, there are 2 inpatient facilities, which really are lovely to have, because if home care is not a viable alternative, then where do you send someone? Where do they go? Do they go to a long-term care facility? Well, they could. They certainly could, and Pam just told you she has contracts with some, and so do other hospice programs. But the inpatient hospice facility really is the next best thing, if you will, to home care when home care isn't a viable alternative. There are some qualifications for someone that's admitted to an inpatient unit too. But it fills a gap that we have in service delivery. It's a lovely.
If you choose home care and your family is very much the caregiver, of course you're both nurses, are there medical people who also come into the home? How does that work? Help us picture a day in the life of an individual who's chosen hospice at home.
That's exciting. I love talking about that.
Is there a story you could share with us?
The care is delivered by a team of healthcare providers. A team, and I can't stress that enough.
Right.
It is a team.
It's really important.
The team consists of, we have a medical director who oversees the care that we provide. They don't take the place of the primary care physician, but they oversee the care.
Does the primary care physician come to the home?
Sometimes. Yeah. Sometimes they do home visits.
Okay.
Many times if they don't, we communicate very clearly with them over the phone.
With the
they
team.
have
they're always involved with the decision making.
Absolutely.
Part of the team.
And they have to sign our orders, our plans of care. So they're very actively involved in the loop. But the medical director oversees the care. We also have registered nurses who are experts in pain and symptom management. They help treat the symptoms that may arise at the end of life, whether it be pain, nausea, vomiting, some of the symptoms that people may come across. We have home health aides that do the personal care. The home health aides, again, I can't say enough about them. They provide the personal hands-on care, and it could be anywhere from an hour, sometimes block time. It could be a few hours for us, depending. It really depends on what the patient needs. We have social workers who work with the patients and families to help possibly integrate them into services that they may need out in the community, or to do patient-family case management. They help them with funeral arrangements, with living wills. They help them with bills. It is. Yeah, we have chaplain services. We have volunteers. I don't want to. I need to say the volunteers.
Definitely
the volunteers.
Yes. The volunteers are a key part.
They're the heart and soul of hospice. Really.
They are, and you know what's really neat too is sometimes volunteers can go in prior to the professional team of healthcare providers and be an assistance for some months before
the whole team is deemed.
They do a lot in providing respite for families, so family members can go out and get their hair cut.
Right, because it's round-the-clock care, isn't it, at a certain stage, and so that you do need respite as the family, I'm sure.
Right.
And therapists.
Therapists, yes,
You do.
We have therapists that go in, physical therapists, occupational therapists, speech therapy, if it's indicated in the patient's care. We also have a contract with, many of the hospices do, but we have a contract with a pharmacy, KPHC, that actually deliver the medications to the patients, to their homes. We cover any of the medications that are related to the illness for which we're seeing the patient for. It's covered under that plan. And they get very creative. It's, many times patients can't take things by mouth, and they have to change the route. They may change a pill form to liquid, or a cream, a pill form to a cream.
Whatever works for the patient.
Whatever works for the patient.
So the pharmacist is also part of the team.
Oh, yeah.
An integral part of the team.
Well, stay with me for just a moment. We'll be right back for more of this very important conversation about choices at the end of life, but stay tuned for these commercial breaks.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both, at Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
Welcome back to Mature Lifestyles. We're having an extraordinary conversation about a very tough topic, but the important thing we're focusing on is choices at the end of life, an issue that we all need to deal with. And it is interesting to me that whenever you bring this topic up, someone has been through the need for hospice or the need for dealing with a loved one's dying. But we're talking about that today to help you make informed choices. And we have the aid of two experts here, Candace Powell and Pam Brown. And Pam was just describing all the wraparound services, if you will, that are there. And during the break, we talked a bit about after the person has passed away, the bereavement services, because it isn't just the individual who is dying, but it's also the family. You started by talking about how you and your husband talked about what you expected, and it wasn't even the same necessarily, but you had that conversation. But probably you might not have had you not been in this area of work, because people don't. And but you're encouraging them to do that. But talk a little bit more about the services that if you've chosen hospice, what about the family at the end?
The family, that's the thing that I find most with hospice is it's not just taking care of the it's not just taking care of the patients, the family.
Right.
It is a unit of care. And after the death of the loved one, we do provide services, hospice provides services for up to 13 months or greater, even in some cases, depending on the need of supportive services. And that might be through connecting a family member to a support group, and we have a whole array of support groups through our volunteer agencies. They're absolutely wonderful. We also do one-on-one counseling. They provide one-on-one counseling, letter correspondence, telephone correspondence. We look at the needs of the family. What is it that they need? And we support them the best we can, because it is true, after the death, they
need that support.
Yeah, they need that support, definitely.
Of course.
And if you do an effective follow-up with a bereavement assessment, then you can help and reassess as you go along and see what families do need to take care of themselves.
I know this show is frustratingly short for the wealth of knowledge that you both have, but you have a few minutes left. What is the most important thing you want the viewers to take away from your advice?
Well, I guess it is about choice, and to encourage people, all of healthcare professionals, you know, it's not about our needs, and we should not measure someone else's reality with our standard of care. It is their reality. We need to listen carefully, and then we need to assess their needs.
So though you're a health provider and you're doing everything you can to make this a choice, it's not your choice.
That's right.
But it's the patient's choice.
Yeah. And we need to, our responsibility is to support them as they're making those choices, to provide all the information they need to make an informed decision.
Which is hard, I think, sometimes, particularly for older people, to say, well, wait a minute, the doctor knows best or the nurse knows best. They're your guides here. You can make that choice and encourage your doctor if this is what you really want. It's your choice.
Right, and we need to empower people to know that they can make those choices.
Exactly.
And that we are not in control of everything. They need to take control.
Well, let me ask you a question. You both have been at this for decades. So have people, they've had the opportunity for hospice for a number of years. Do you find the numbers increasing, the people who take advantage of this opportunity, this choice?
Absolutely. Thank goodness. We've really worked together. Partnerships are another thing that are really important with healthcare professionals and allied healthcare professionals, working together to create more awareness about end-of-life choices. And utilization of Medicare hospice alone has really increased significantly over the past 10 years.
And policymakers get it too, don't they, more in terms of making this an option for people?
Absolutely.
I think that's happening.
Absolutely. You know, years ago, when I would go to the legislature and talk about hospice, I would do most of the talking. Now when you go,
it's a conversation.
It's a conversation. Almost everyone on any committee has had an experience in their own family or neighborhood or community. Yeah.
It's like we're learning about preventive care all of a sudden, and we're learning about choices again, because that's what people want for themselves. Really important words of wisdom from your part. What would you like for people to remember about this option?
That choice is number one. that people do have choice. And if you choose hospice and it may not be right for you at that point, you can always choose to revoke. That's always a choice.
Oh, that's an important point. Would you say that again?
Yeah, you know, if people come onto a hospice program and find that maybe it's not for them, they can always choose to revoke, and that is a personal choice.
Choice continues to the very end, doesn't it?
Absolutely, right up, you know, to the very end. So I do think choice is probably one of the most important, and to educate yourself and to access the care as early as possible. What I have found with some of our patient surveys is one line that I hear often is, I wish we had known about it sooner. And you know, I think if people get into the programs, they realize the help that can be provided, both emotionally, spiritually, physically.
Right. Do you think they don't know about it sooner because nobody wants to deal with it? Do you think that's part of it? Because I know you both work very hard to educate people as to Spectrum Generations, but talk to us about that.
Having conversations about end-of-life care is it's about social change, improving those, making those easier for people to do. Social change sometimes takes generations. I mean, we've been working in a concerted way with hospice for 30 years in this state and in this country. And a lot of our fears and anxieties still play a huge role here. And we need to make sure that we make it as comfortable as possible for people to ask questions, to have conversations. I know, and I'm sure you do, Pam, that we encourage folks to make a list of questions when they go visit their physician or their health care provider.
Where do you start? Let's say that you have a loved one who faced a diagnosis where they know that they have a terminal illness, and I forget the words that you thought were more useful to the patient. But where do you start? Let's say that I learned that a family member of mine would be in need of hospice if that was a choice, but I've got to get the patient to agree. I've got to get my head around it as well. Where would I start?
You know, I'm just going to jump right in here and say a lot of people call our office at the state because they don't know what they don't know. You know, and they call us and ask for that guidance. And I might refer them to Pam's agency or another agency. First, I'll ask them, where do you live? Yeah, what community do you live in? And again, in keeping with choice, then you list all the hospice programs.
Are there opportunities for access all around the state?
There are.
You're located in Central Maine.
Right.
But there are people like you in other parts of the state as well?
Yes.
Okay. There are 27 hospice programs in the state of Maine.
So the whole state is covered.
It is, more or less.
More or less. Well, we are a rural state, I understand that, but still there's some service most likely available. Not too far away, I hope.
Yeah, there are some areas that we need a little more concentration.
So that's an opportunity for volunteers. They might want to help create that opportunity in those underserved areas.
And again, for partnerships to provide some access in those areas.
So they could start by looking Google, I suppose, hospice care and find you. Or they could go to something like Health Reach, or even their own doctors, I would assume, would be a door to finding information about hospice care.
Absolutely. They could really go to their clergy person, to their social worker,
and that's part of your job, is making sure that those access people are educated about options too.
That's right. And then if they are, once we tell them what hospice is, if they're at all interested, then I encourage them to go to their physician and say, you know, I heard about hospice.
Because it is a partnership.
It is. I heard about hospice. Could you, I think my family needs some support. Could you refer me?
What if you and your husband disagreed about this? How do you handle that? Do the hospice volunteers help the families who are not sure they want to do this at least come to a mutual?
As far as care itself?
As far as care itself.
Yeah, you know, it's that, yes, definitely, the volunteers do. I do also find the rest of the team members are very sensitive to that as well. And we do provide a tremendous amount of education to the family. And then a lot of times what I do as a nurse, I'll go in and feed them information or give them information and then step back and let people digest it and think about it and see, and then maybe go back to revisit to see if that's appropriate, you know, for them.
You know, another thing Pam, I'm sure, does, and other hospice programs do, when there is disagreement in the family, is to call a family meeting. Family meetings are a wonderful way to sit down and everybody listening to the same information at the same time, should they choose.
Because it's overwhelming, isn't it? I mean, you're facing the news, if you will,
It is.
and then the individual, the fears
Oh,
the fears.
Front and center. So,
And again, the choice aspect seems so very important. You've also mentioned volunteers. Are many of the volunteers people whose families have been through a successful experience with hospice?
I find that when I do education, I find that
they saw how valuable it was, and they want to give back.
And they want to give back, absolutely. And one thing I find is the volunteers tend to be the most busiest people in the world, but they find time to give of themselves.
Well, that's a real tribute, isn't it, to the experience, to a family member. Well, this has been an extraordinary topic. We could talk for hours, but we have some more very important information from a Medicare specialist, Karen Crum. So stay tuned, and you'll know how to deal with your Medicare.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
Welcome back to Mature Lifestyles, and we have a very special person here, Karen Crum, who is a Medicare D specialist, and there's some early open enrollment this year, and she's going to help us know how to deal with that. Karen, what's going on with Part D, and what do we do at this open enrollment period?
Well, most people know that we have a set time every year where you have to make your annual enrollment changes. The news this year for 2012 plans is the enrollment period is much earlier.
And the dates are?
It began October 15th.
October 15th.
But it ends December 7th.
And that's a key date, December 7th.
So we do not have to the end of the year as we have had in previous years, December 7th. And it's important to pay attention to this time. This is your opportunity to make changes to to enroll for the first time if you haven't before, and to make changes to your plans. If you don't do it during this time, you may be without coverage next year, or you may be stuck in your current plan
which may not be the best for you. Things changed.
It may have changed, or you may lose. You have opportunities now to look for a better deal. You should be comparing at least several plans for premium, copay structure, deductibles, and your drug coverage for your prescribed drugs.
What drugs you need specifically, you want to make sure they're covered with your plan.
That's right.
Okay.
That's right, because plans do differ. And every year there are new opportunities for savings.
And some plans have higher copays than others? Or
for some drugs.
For some drugs.
So it's very specific to your list of drugs.
And you are a Part D specialist. Does that mean that if I needed some more help, I could call Spectrum?
That's right. There's help at each of our community centers during
the community
this period.
centers is the place to go.
Spectrum Generations has Part D enrollment clinics taking place all through this period to help people with information and assistance in comparing plans and enrolling in their plan
Wonderful
choice.
News. So what's the most important message that you're going to send to our seniors and family members who are watching?
Well, do it by December 7th.
December 7th.
Get help if you need it. Spectrum Generations is available.
If you don't want to make any changes, do you do anything?
If you're currently enrolled in a plan and you're happy with it, no, you don't have to do anything.
So this is a time to make the changes that better serve you.
That's right.
And December 7th is the magic date for this year.
That's right.
All right. Well, thank you very much, Karen, and thank you for joining us on Mature Lifestyles. It's been a pleasure to be with you today.
Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
You're watching TWC TV, only on Time Warner Cable.